Number 1. Silent heart attack. Most people think that a heart attack always comes with severe chest pain, sweating, or collapsing on the ground. But in reality, a silent heart attack can occur without these dramatic symptoms, and many patients don't even realize it until it's too late. Silent heart attacks often show very mild or unusual signs, such as slight indigestion, fatigue, or discomfort in the arm or jaw. Many people confuse these symptoms with acidity or simple tiredness and ignore them. The dangerous part is that the damage to the heart muscle is still happening inside the body, even though the patient feels relatively normal. This leads to long-term complications such as heart failure and rhythm disturbances. Studies show that people who suffer silent heart attacks have almost the same risk of death as those with typical heart attacks. That's why ignoring minor chest pressure or unexplained breathlessness is a big mistake. Never ignore unusual fatigue, chest heaviness, or unexplained discomfort. If in doubt, get an ECG and cardiac enzyme test immediately. Early detection saves lives. Number 2. Microstrokes, transient ischemic attacks, TIA, a sudden difficulty in speaking, temporary blindness in one eye, or weakness in one hand might be brushed off as stress or weakness, but these short-lived episodes are actually warning bells of a full-blown stroke. A transient ischemic attack, TIA, also called a mini-stroke, happens when blood supply to the brain is temporarily blocked. The symptoms may last only a few minutes or hours, so people think it was nothing serious. However, medical science shows that nearly 1/3 of patients who experience a TIA suffer a major stroke within the next few weeks or months. This makes TIA a very critical condition that must never be ignored. Patients often self-diagnose it as low blood sugar or dehydration, but the brain's vessels may already be at risk of permanent damage. If you or someone experiences sudden difficulty in speech, vision loss, or weakness in any limb, even if it goes away quickly, seek immediate hospital care. It may prevent permanent disability or death. Number 3. Sleep apnea. Snoring is often taken as a funny or annoying habit, but heavy snoring that stops breathing during sleep is not just a family joke, it could be a silent killer. Sleep apnea is a serious condition where the airway collapses during sleep, causing repeated pauses in breathing. The patient may not even know this is happening, but the brain and heart suffer from oxygen deprivation. Over time, this condition increases the risk of high blood pressure, diabetes, stroke, and even sudden cardiac death during sleep. Many people ignore the warning signs like loud snoring, daytime sleepiness, or morning headaches, thinking it is just tiredness. However, untreated sleep apnea drastically reduces quality of life and lifespan. Sleep studies, polysomnography, clearly prove how destructive this disorder is. If you or your loved ones snore loudly and seem to gasp for breath at night, consult a doctor. Use CPAP therapy or lifestyle changes to reduce risks. Don't take it lightly.